Miss Faith. Today I'll be going through with you on how to start an IV. First, we'll hang in the IV bag, then inserting the IV, and also how to dress and undress an IV area. But first, I'm gonna grab my bag and also grab the things that I need. I'm gonna check the bag of IV against my MAR twice. So against the doctor's order, against the MAR, and the drug, and also the third time will be by my patient. I'm gonna grab everything. To start hanging the IV, since this has already been opened, I'm just gonna take this part out.
Cool.
Got it out, finally.
I'd be very excited.
Going to hang it. Making sure there isn't any kinks. Now to prime the
I'm gonna grab my
prime the IV just to make sure there isn't any bubbles or anything that would affect the patient negatively. I'm going to squeeze the chamber to make sure it's 2/3 full. All right, that looks fine. Going to unclamp and prime.
probably threw away the plug for my. We did. Oh, I don't. I'll look at it. Right, I'll plug this one.
We have completely primed it, so I'm gonna rock it. And now I'm going to start my patient with a site. So I have everything organized and prepared.
Yeah, I tried because last time you do. Yeah. Yeah, when you like go to hook it up to the claim. Yeah.
All right, I'm going to try to find the a nice vein for my patients. So I'm going to tie the tourniquet. And you want to get it a little bit tight, just so you can have that right vein popping out. All right, so I'm going to assess the area, the skin area, making sure there is good skin integrity. Okay, this looks like a really nice bouncy vein, so I'm going to assess to make sure there isn't any pulse, so just to make sure it isn't an artery instead of a vein. All right, looks good. I'm gonna clean my area because everything has to be sterile.
Yeah, one time. Deleting some so that we could take more of my phone and space. And they had
clean it in a vertical or horizontal position. Also in a circular from in out. And this should be for about good 20 to 30 seconds. Alright. I'm also going to clean my fingers. Just wherever that I'm going to use to touch the patient. Okay.
Okay, so today we're going to be talking about IV insertion.
Let it dry.
So first, I'm going to show you how to hang the IV fluids. When I get the IV bag, I will make sure to check it against the mark, check the 6 stripes, and make sure that everything's good, that it's not expired.
Now because I've touched all of things, I'm going to clean my area again. Clean my fingers again. It has to be as sterile as possible. Alright, now I'm going to insert the needle. Find the vein, insert the needle. Wait until you see a flash of blood, just to verify that it's in the vein, not an artery or in the muscle anywhere else. There's a flash of blood. Okay, now I'm going to thread while pulling the needle.
So now that I have it hung, what I'll do is I'll squeeze about half to 2/3 full.
Thread all the way. It's been threaded all the way.
And then I'll have
I'm going to take the needle out.
find my tubing. So I'll undo both of the clamps. I'll take out the clamps. And it's already coming out. Okay.
Alright, now it's time to put in the with the autoclave.
I make sure my tubing's fine. There's no bubbles. I would place it over here. And I put the cap back on.
It's time for the flushing.
Okay,
But before I do that,
and,
you have to take the
I'm going to do my IV.
tourniquet,
So I'm going to start with the tourniquet.
and I'm going to flush.
So first I have to put the tourniquet on to find the vein. I need to make sure that it's a vein that's not too superficial. I need to make sure that it's a vein that's like off of palpation. I need to make sure that it's not in a bifurcation. Okay, so
Alright,
letting them get
to
some
flushing,
Okay.
it's time to tape the area.
I've already prepared my tape. I've prepared my flush. So I will go ahead and leave this on for the IV. But what I need to do first, now that I found my site, I need to clean it. Get that fine.
Literally minimal.
There we go. And I'll clean the site really well.
So it needs to be a lot better than this, of course. It's just not sticking as of right now, but with this you are gonna date and time, put the initial of whatever you did on this before you put it in. And this is just to secure the IV site a little bit more, just in case the patient becomes a little uncomfortable and they're trying to take it out. There is an extra protection against that.
I'll hold it with the bevel up.
Okay.
I will make sure that I'm going at 45 degrees.
Alright. And after that,
Go into the vein and I see a flash of blood. So what I do is I
going to insert the IV.
take this off, and then I push in the cap on. Okay, so now that I have the cap on pushed in, I'm going to
And the drip rate has been set.
fingers and apply pressure with my other finger. And we tap this.
Drip rate has been set.
Flush ready, which I've already primed.
The IV is going in. And now it is time to undress.
Okay, so I have that in. And then I'm going to pull back for a little bit, and then I have blood. So I'm going to push
Applying pressure onto the vein.
So I push this in.
Going to take the IV
And then I
area
take
off.
this off. And leave this on. And then I will. So I'll push this
With a
to my
clean
knee,
gauze.
and I'll tape it in a U fashion so it stays down.
And slowly, depends on the patient's skin, Because some patients, some patients, such as the elderly patient, they might have some sensitive and soft skin, which can be easy to cause injury to. So you have to be careful. And based on their skin, you might also need to make use of an alcohol swab just to clean the area and just to take the adhesive tape off. But gently take it out.
Make sure to do it carefully and nicely so that it sticks to the patient's skin. And then what I would do is I would initial and date and time it. And
Okay.
I would put this out of the way of the IV so I can
Applying pressure, I'm going to
make sure that,
gently
there's no infiltration or phlebitis.
take it out.
And then now that I have my IV done, I would apply
Okay.
which normally would not be done.
And I'm going to apply pressure, a little bit of pressure, and I'll put a band-aid on it just to stop the bleeding. And that is how you start an IV and do a IV dressing and undressing. Thank you.